Hi everybody, it's Dr. Cary Yurkiw here. I am the founder of True North Practice Management, and today I'm talking about unlocking your practice potential and strategies for growth and success. And this is part of our free webinar series on Eventbrite and through our website. And I started True North Coaching a couple years ago to help health professionals with their practice. And I've been practicing now for 30 years. 25 of those years have been in private practice. So it's my way of teaching others what I've learned and kind of giving back to the community. So I started this company to help health professionals, doctors, therapists, chiropractors that are in private practice and kind of struggling, not really knowing what to do, because we don't have a lot of training in business at all in college. We learn a lot about conditions and diagnosis and treatment, and we're experts at that, but we really don't have a lot of business training. So in private practice, we can make a lot of mistakes, and that can result in a lot of stress for health professionals. So there's the treatment side of things, which you're an expert at, and then there's the behind the scenes, the business side of things, which many of us get out of college. We're rookies. We don't know a lot about that. So my name is Dr. Cary Yurkiw, and I am a health professional. I'm going to just switch screens here. And I've been coaching for several years now. I've actually worked in over 80 clinics as a health professional. So I've helped over 80 clinics with their business, and we offer webinars, mastermind groups, and group coaching and one-on-one coaching. So for today's topic, understanding the landscape, we want to talk about challenges and opportunities in today's healthcare environment. So healthcare is always changing, and it's important that we keep up with trends. My neighbor here at the clinic is a denturist, and there's new dental coverage that's just been brought in by the federal government, and they said they're really slow right now because everybody's waiting for the benefits to kick in for the dental coverage. So that's what I'm talking about when there's challenges and opportunities in today's healthcare environment. And sometimes it's really hard to get a grip on how the changes can impact you because you don't know, or you may not have all the details. So this is one good example where for them, they need to find out all the details, how to go about billing the new program, and is it 100% coverage, or are there co-pays? How does that work? It's important to be adaptable and to innovate because if you don't innovate and if you're not adaptable, then you're going to get stuck. And I can remember early in my career when I would go for lunch with a group of chiropractors every Wednesday. And when I'd go for lunch, there were two subgroups. One group were the chiropractors that basically had been practicing for years and thought they had it made. Basically they were doing the same thing day in and day out. And then there's the other group that was constantly innovating. So they were going to webinars, seminars, they were bringing in new technology into their clinic, and they were very excited about their practice. And I found that interesting because as I went and worked with those chiropractors in their offices, I saw the vibrancy of the clinics where there was that continuing education and those chiropractors that were challenging themselves no matter how many years they're out in practice. And then there's the other ones that were just kind of cruising. And I kind of made a decision at that point that I didn't want to be in the group that was just kind of cruising. I wanted to continue to challenge myself, continue to give the best service, and keep growing as an individual. And here I am 30 years later, still doing that. Still doing that in my practice, as well as doing coaching and consulting like this at True North. We want to understand patients' expectations, and I think now it's kind of easier than ever to meet and exceed patient expectations, because generally healthcare professionals don't give good service when it comes to patient appointments. Often clinics are running late. Often there's a hurried atmosphere in a clinic, and the patient gets frustrated with that. And I've always wanted to run my clinic on time. I've always wanted to notify patients if I'm running late. So we send text messages out before appointments just saying we're on time, ready for you when you get here. We're 5 or 10 minutes behind. Is it okay if we move your appointment? So we're always being proactive with the schedule, so that way when the patient shows up, they come into the clinic, they feel important, they feel like there's like a VIP, their service is just for them, and there's that one-on-one time that is so valuable without a lot of distractions. So that's the way I like to run my practice. I encourage you to do the same thing, because what it does is it leads to really happy patients and lots of referrals. And we're going to talk about that today, but referrals are so important to grow a practice and to develop your practice. So to grow it and manage a better practice, it's important that you run your clinic on time, you're meeting and exceeding expectations, and that you can get those referrals. Now, the power of patient feedback. So we like to do surveys in our clinic, and when we do the progress examination for our patient, we have a form, and the patient basically fills out that form, and some of the questions are geared towards the patient or customer service that we're providing in the clinic. Are the patients happy with the care? Would they leave us a 5-star review online? Is there anything we can do to improve? The last time I did one, the patient said it would be nice to have a children's table and some toys in the clinic. I thought that was a great idea, because we are a family-based clinic, so welcoming children to the practice is a fantastic idea, and one way to show that is to have a children's table or children's area and some toys. But most people will say your service is great, 5 stars. And then what we'll do is follow up with them and say, can you leave us a 5-star review online? And they do, and that allows us to climb the ladder. And we climb the ladder with rankings on Google, rankings on RateMDs, and rankings on Facebook that really help, because when we do our advertising and people click on our ad, they're going to see that 5-star rating, they're going to see we're ranking very highly, and we're also going to get some organic reach because of our 5-star rating. So very important to do. So the feedback you get from patients, you should be checking with your patients on a regular basis just to see how's the service, how are you feeling, are you happy with the care, and you can get your staff to do that. It's always better for them to do it rather than the doctor or the therapist doing it. And then in your forms, when you do your follow-ups, make sure your forms have those questions on them, in addition to the questions that are geared towards how they're improving, how their health is improving. And you want to monitor the progress of your clinic with some of the changes that you're making. So, for example, if I did put in a children's table today, we want to see, are there more children coming into the clinic because of that? So we want to have some statistics, we want to have numbers, because we want to know if our decisions are making a difference. Now we're going to talk about operational efficiencies in technology. So operational efficiencies, actually that's one area where I think we've really excelled in my practice over the years, is the efficiency of the office. And often we get compliments here about how efficient the clinic is run. Kind of shared with you the steps of keeping the clinic on time, but also the clients I have here at True North, one of the things I stress is efficiency. You know, when you're in the office, you want your time to be well spent. The doctor and the therapist are the most highly trained. Their time should be interacting with the patients, and then you should have staff basically trained in doing the rest. So if you don't, if you're a small practitioner, you just got out of college and you're starting up, you might have to do everything. But as soon as you can afford it, as soon as the conditions dictate that you can get a staff member, you should search and hire a good staff member to help you. And some of the areas recently that we've been increasing our efficiency is voice transcription for doctor notes in real time. So our patients think it's pretty cool, and we let them know on the consent form that we use voice transcription software. And then what happens is when they're in the clinic, we're doing the history taking, they can actually see the voice transcription going across the screen, and they think it's phenomenal. And that's for a few reasons. One is they know that they're being heard, and they know that we're not missing anything, which is a major complaint patients have of their doctors or therapists is they didn't really listen, they don't really understand what my condition is. So I think it's important that you listen, you record everything, you can read it back to them. So basically, as you're doing the transcription, you want to reiterate that they have pain in their neck, pain travels down to their shoulder, down their arm, or whatever profession you're in. You want to make sure that they're being heard and you're communicating effectively. You also want to ask questions like, is there anything else I need to know about you? Do you have any questions for me? These are very important ways to end the history taking. And if you do have someone helping you, you want to make sure that they're well trained on how to do a history taking. Now, for marketing steps, that's something else that we've really been improving on, is using freelancers in the clinic to do our Google ads. So experts in the field of Google advertising and optimization, that's really brought in a lot of clients for us. And so optimizing your Google ads, keeping on top of that as your optimization score drops. Also optimizing your Facebook ads, making sure that those ads are well done and they're being very effective. And you might want to use some codes on your ads, like a discount code, so you know where the patient's coming from. That's very important. With patient flow, you want to make sure people are going into the right rooms. One of the things we do is kind of a holdover from the COVID time, is when a patient arrives at the clinic, we ask them to text us and wait for a text back. So we have to watch our phone closely. We get a text that the patient's arrived, and then we want to send them a text back saying, we're ready for you, please come in. And that way, when they come in, they get set up, they're going right into a treatment room or an examination room, and it really helps the flow of the clinic. Scheduling is part of that as well. We won't cover that today, but making sure that people are scheduled accordingly, and that you can see your patients in a timely manner, that's very important as well. And then steps for integrating new technology into your practice. So I encourage my clients to continually search for new ways of improving their service. So in my clinic, we brought in shockwave and laser. Those are additional services that I offer here. We do orthotics, orthopedic shoes, another revenue stream. But one of the things I've been looking at is an orthotic scanning equipment that I saw down in Las Vegas when I was there for a marathon. And the scanning equipment by Atrix, my wife stood on the scanning equipment. It took a 3D image of her foot, and then it detected the pressure points of her foot on the pad, and it made a recommendation to either one of the standard orthotics that were on display there with kind of a code to match up with the orthotic for that person's foot condition, or if it was too complicated, then a recommendation for orthotics. And that's something we do in the clinic. So that's a new technology that I want to bring into the clinic this year, is that 3D scanning equipment to be able to show patients how their foot's out of alignment, where they need arch support, and just give that visual representation. Another thing we can do with that is take that to the mall and do mall screenings, which are going to bring in a lot of clients to the clinic. So I really like the display, how it's presented, and that's something we're looking into right now. And you could do the same thing in your profession, just to bring in new technology to really wow the client, to stand out in your field, and to bring new clients in. So on this slide, what I'm talking about is expanding your patient base. And to expand your patient base, you want to have marketing strategies for healthcare practices internally with the patient. And one of the things we like to do is every month we print a new coupon and a coupon code, and we give patients coupons. Now the coupons could be for the additional services we have in the clinic, but they could also be for referrals. So this month we have both of those coupons in the clinic, and that allows people, number one, it tells them that you're accepting new patients and you want new patients. And number two, it's going to potentially bring in new patients because people are going to have something to hand to their friends or family and say, you should really take advantage of this because it's a good discount offer until the end of this month. So it's a good way of promoting your services. Also, building a strong online presence is important. And the way I do that here in the clinic is with the social media marketing, Instagram, TikTok, Facebook, X or Twitter, YouTube, and podcasts. So we want to get as much of a reach as possible in the community. And so I would highly recommend that that's something that you do is reach out to people in your community through social media, through advertising, and networking. Now, networking, you could put on an open house in your clinic. You could go out into the community and network with the businesses in your area. I kind of encourage my clients to stay within their local area because it's more likely those people are going to find it convenient to go to your clinic. So try to stay in a radius around your clinic. I would say a couple miles is good, or 3 kilometers, and just stay within that radius so that you can network with those professionals. Go use their services, refer to them, take the initiative, and you're going to get the same thing back. It's like karma. You're going to get the referrals back to you. Oops, sorry guys. My slide is glitching. So, all right, so assembling your dream team. Now on this slide, what I'm talking about is how to assemble, how to assemble your dream team. So what can you do to get the right staff? And this is something that I have a lot of experience with because early in my career, I had a staff agency. So I had a healthcare employment agency where we screened candidates, we hired candidates, we sent them into temporary environments, and then sometimes they were permanently placed. So I know a lot about hiring through the agency that I owned and ran, but also through my own personal experience with my clinic. So you want to hire for your culture and the skill level. So when I'm talking about for culture is you basically want to make sure that the new hire knows your mission and vision, knows how you like to practice, and is a good fit. So you want to do that during the initial assessment phase when you put an ad out to get candidates. When you talk to an employment agency, you want to let them know what the mission and vision is. And then what the training and professional development will be. So basically you want to put together a training plan or a job description with steps of how you're going to train a new hire. So I recently had to do this in the clinic, and that's what I did. I answered the questions on the job bank very thoroughly. I then put it together a job description, and from there I put together how we're going to train the person on that job description. And we developed 5 phases for training. And right now I just hired someone and she's in phase 1 of training. So as we progress through those phases, there's clear benchmarks to go from one phase to another. So very important. And we actually did Zoom meetings with the best resumes, so a 15-minute Zoom meeting, and then the best candidates went on to an in-person meeting in the clinic. And then we kind of discussed the job description and the training, and then we took the best candidate from there. So it's a really good way to find the best people. And you want to foster a collaborative team environment. You want it to be fun but challenging. You want people to feel like they're contributing to the outcome that you desire. They're making a difference in patients' lives. You're changing and saving lives through the work you're doing, and you're changing lives in the community. And I think that's really important for your staff to know, and that they're a big part of that approach, because what I've told my staff over the years is 1 + 1 = 3, that we can do a lot more with 2 people collaborating than the sum of the parts. And then you want to give them challenges, and you want to reward your staff for achieving those goals, and you also want it to be merit-based in your clinic. So the more they can achieve and the more they're willing to take on more responsibility, the better it's going to be for them going forward. So you do want to give people that opportunity to progress and achieve their goals. Now, recently, colleagues and clients have said, it's really hard to keep good people, and I agree. I think, there's a lot of job hopping. Somebody gets a better opportunity for wages, or maybe better hours or something like that. They're going to want to jump ship. And what I tell new hires is, I'm willing to hire you, but if you decide there's a better opportunity and you want to take it, all I ask is that you help me to find another person and then train them, so I don't have to retrain them. And we put together a job, kind of a training manual that the person can basically refer to, and then they're going to get some guidance from me, as well as the person that's exiting the clinic. So you want to work with that situation in the current job environment so that you don't have to do retraining. And that's something that I did see from some of the clients, is hiring and then retraining, and it's just like a revolving door where people are coming in, coming out. It's very disruptive to a practice, and it's not a good use of your time if you have to retrain on the same job position. So now, your path moving forward. What are some of the summaries, key takeaways from today? Well, one of the things we talked about is to be innovative. So make sure you're innovative and you're challenging yourself to be better at what you do. Number 2, we talked about efficiencies. We talked about making your practice more efficient, whether it's scheduling timely appointments, whether it's spending quality time with the patient one-on-one. Very important. We also talked about advertising, both internally, encouraging referrals and getting good ratings, but we also talked about external marketing, Google Ads, Facebook, and networking in your community. And then we just talked about building a team. So as you get busier, how to look for the right people, hire the right people to help you with your practice. So I want to invite you to join join us at True North. So basically join our group, and the way you can do that is by going to our website. I'll show you that in a minute. And you can just enter your information and go on our mailing list. We will email you when spots are available for our group coaching or one-on-one coaching. We're also going to keep you updated on any workshops or master classes we have coming up. Now, the next free webinar is coming up on Saturday, April 27th. It'll be at 8 a.m. Pacific or 11 a.m. Eastern, and it's going to be on financial freedom for healthcare professionals. So we want to maximize profitability in private practice. So I'm going to talk about that. That's kind of after you're running a good practice, you're going to bear the fruits of your labor, and then you want to make sure you manage that well. So you want to manage your resources and finance as well, because you don't want to be working very hard and then all of a sudden you're basically blowing the money that you're making in the clinic. So we're going to talk about that. And there's a lot of health professionals that get taken advantage of because generally their income levels are higher, and a lot of salespeople, vendors will try to get health professionals as their clients. So you can get taken advantage of, and definitely we want to avoid that. We're going to talk about that, how to maximize your profitability in private practice on April 27th at 8 a.m. Pacific, 11 a.m. Eastern Time. And then the last thing I want to show you is our website where you can join us. So if you go to trueexpert.pro right here, what you're going to see is our homepage, and you can just click Start Your Journey. And when you click on that, you'll be asked to put in your information. There's a couple short questions. If you're interested in a consultation, so you can sign up for a consultation or just join the mailing list. And we'd be happy to reach out to you via email. I'll let you know what the upcoming webinars are, master classes, some of the group coaching, and I'll keep you posted on how our business is developing as far as consulting goes. So if you want to join us, just click on that link right there. Join us today. If you're here on YouTube, I put the link in the chat. You just have to click on that link. And here on Instagram, if you're live with us right now, all you have to do is click on the link in the bio, and that'll take you right over to our website. So I want to thank you for joining me today. One more thing I'm going to mention actually is we just set up this link where you can click right there and then go to our blog. And usually I'm posting blogs every day or every second day. This was today's blog post, here's yesterday's, and it's usually revolving around the webinars we're doing like this one. So if you want to stay current, just go to our blog and you can see articles that I'm writing with the information I'm researching for the webinars. So thanks very much for joining me today. I hope you enjoyed this